We don't want to go anti-medication here, but we also want to educate people that there can be a different way, or there can be a way to complement the current treatments that are happening.
Every person who can publicly share their testimony and share what they've been doing, you have no idea how many people you're helping behind you.
Before my book, Brain Energy, was published in the fall of 2022, I was joined by a small group of volunteer advocates who believe deeply in the power of metabolic therapies to transform outcomes for countless patients. We met regularly every Saturday morning over Zoom to discuss strategies for sharing this information with the world and trying to improve mental health care. After the book came out, I began receiving countless messages from people who wanted to volunteer and join the movement. It was incredibly inspiring that there was no real infrastructure to harness all of that passion, expertise, and lived experience. I was honestly overwhelmed. I was invited to speak on over 100 podcasts, national television shows, national radio, and conferences around the world. While trying to manage all of that, I also received a $3 million gift to start the Metabolic and Mental Health program at McLean Hospital and Harvard Medical School, while continuing to run their continuing education program. With thousands of people reaching out for treatment, I added more work to my plate. I launched MH², a new clinic that is redefining healthcare by integrating mental, metabolic, and physical health into a single cohesive model and demonstrating what is possible in terms of meaningful recovery from serious mental illness. While I focused on all of this work, the early seeds planted by those first volunteers kept growing and have now taken shape as a new nonprofit organization, Metabolic Collective. Metabolic Collective fills a vital gap. It provides the structure and support needed to cultivate a peer and family-led movement dedicated to transforming the mental health system and advancing widespread adoption of metabolic therapies for psychiatric and neurological conditions. I'm honored to have helped spark this effort and to continue serving as a clinical advisor for Metabolic Collective. And now I'd like to turn it over to one of the original volunteers who helped bring this vision to life, Hannah Warren.
When I first connected with Dr. Chris Palmer and a small group of volunteers helping him raise awareness of metabolic therapies for psychiatric conditions in the fall of 2022, I was just over a year into my own journey treating bipolar 1 disorder with ketogenic therapy. At that time, I didn't know a single other person who had used keto for their mental health. Finding others with similar lived experiences and coming together to help raise awareness played a vital role in my own healing, as it gave me a sense of purpose and a supportive community. After Brain Energy was published, Chris began receiving an overwhelming number of emails from people who wanted to help. When I joined the Metabolic Mind team in the fall of 2023, I saw that we were also getting numerous emails from people asking how they could get involved in spreading the word and supporting others. I stayed really close with some of the people I met through volunteering, and we all felt there was a dire need for a grassroots organization to take this on, one built on lived experience, community, and purpose-driven advocacy. Together, our founding board, including me, MJ Lehman, Wes Braden, Anne Albahish, Kristen Tidwell, and Janet Ebos, decided to create Metabolic Collective, a new 501c3 nonprofit organization that is patient and family-led, supported by public donations, and designed to empower a global network of advocates. I also want to thank Catherine Tate Ringer for leading numerous focus groups with peers, families, and clinicians who are involved in this movement to help us develop our strategic plan. We're also really excited to welcome new board members, Garrison Grant and Eddie Rodriguez, who will actually be taking over from me as board president in February of this year. We also have phenomenal new staff, including Natasha Smikles, Robin Dobbins, and Emily Harari. Metabolic Collective, to be clear, is a totally separate entity from Metabolic Mind and Bazooki Group. You can think of it kind of as a sister organization with a distinct and vital role to play in accelerating the adoption of metabolic therapies by building grassroots communities. Before I share a brief overview of our mission, I want to tell you just a little anecdote, a little story about someone who to me really embodies it. That is Janet Ebos. Janet is a high school music and math teacher and mother of Seth, her absolutely brilliant son who developed bipolar 1 disorder and had to withdraw from a competitive biomedical engineering program. Like so many parents, she went searching for answers. Discovering ketogenic therapy gave her real hope for Seth's recovery. Janet immersed herself in learning everything she could, completing training programs with Dr. Georgia Eade and licensed mental health counselor Nicole Laurent. While the journey hasn't been easy, Seth is now finding meaningful recovery through metabolic therapies. When Janet joined Metabolic Collective's board in the summer of 2024, she became one of the most devoted people I have ever worked with on anything. She said yes to whatever was needed, whether or not she had any experience at all. She would just figure it out as she went and work her magic. She took on critical operations and administrative tasks and met with countless peers and families, and even went to visit some patients and families in crisis when they were at a hospital within driving distance. Janet's superpower isn't just a specific resume that makes her uniquely qualified to help lead a grassroots movement. She is something much more important: intrinsic motivation rooted in lived experience, that unmistakable, genuine drive to help others find the hope that she found. She also appreciates the value of connecting with this community, as it really helped her to stay strong, positive, and balanced during really tough times. Janet and I both agree there are countless peers and families who share this same innate superpower. Leveraging this can expedite the movement in a way that nothing else can, and play an absolutely key role in making metabolic therapies mainstream. Our vision for Metabolic Collective is to create something akin to Alcoholics Anonymous for metabolic therapies, designed to support people and meet them wherever they are on their journey, from initial adoption through post-traumatic growth, continued self-development, and then meaningful advocacy to help others and ultimately drive societal change. You can learn more about our plans to accomplish this in our Case for Support documents linked in the video description. At Metabolic Mind, our goal is to transform 1 million lives by 2035. But with a grassroots movement led by people like you, I believe we can reach that goal much sooner. Together, our patient and family-led efforts can create a ripple effect of hope, healing, and ultimately systemic change in mental and neurological health care. With that, I'd like to turn things over to my colleague, Dr. Bret Scher, who will interview a couple of our amazing new Metabolic Collective leaders.
One of the favorite parts of my job at Metabolic Mind is to both have a hand in sharing and hearing all these amazing experiences people have had with ketogenic and metabolic therapies and how they've transformed their lives. And now a new group called Metabolic Collective, a nonprofit, is trying to help organize these individuals to really form an advocacy group, a grassroots advocacy group where people can get involved, where they can have a community, where they can learn from each other, contribute to each other, mentor each other, and really help grow this emerging field of metabolic psychiatry from the ground up. And today I'm pleased to be joined by Natasha Smikles, who is the Director of Impact and Operations at Metabolic Collective and has worked for over 20 years in the mental health field as a psychiatry nurse and has her own personal experience, as you'll hear, with metabolic psychiatry. And also Eddie Rodriguez, who actually has a background in finance, but he's the VP of the board of Metabolic Collective, and through his own family and personal experience as well, has a passion for metabolic psychiatry. And together, they have a clear passion for helping others learn and bringing together people as a community to help everybody live better lives through metabolic psychiatry. So I really hope you enjoy this interview with Natasha and Eddie about the Metabolic Collective. All right. Well, Natasha and Eddie, thank you so much for joining me today at Metabolic Mind.
Thank you, Bret.
Yeah.
Thanks for making the time.
Of course. So I want to hear all about Metabolic Collective. There's a lot to get into here. But first, before we even get into that, I want to hear from each of you, briefly, what got you interested in this whole field and what got you interested in Metabolic Collective? So Natasha, let's start with you.
Okay. So my background is I've worked about 20 years in the mental health field as a psychiatric nurse. So, that was everything from acute psychiatry to community crisis services to community mental health worker. And then the last probably about 10 years, I just did my own private practice as a psychotherapist. And it would have been about a year and a half ago, I came across one of Chris Palmer's podcasts where he was talking about this new emerging field of metabolic psychiatry, and more specifically, how therapeutic ketogenic diet was helping individuals who were struggling with severe mental health issues. And at that time, probably about a year prior to that, I was actually diagnosed with ADHD as an adult twice, because the first time I had a really difficult time even accepting the diagnosis, but I had all the symptoms. I went for a reassessment and they were like, yo, you definitely meet the criteria. So after coming across Chris Palmer's podcast, I did decide myself to initiate a ketogenic diet. And I had the most profound experience when I started to incorporate not only a ketogenic diet, but other metabolic strategies, such as, I incorporate a lot of meditation now. I try to get outside a lot more, improve my circadian rhythm, getting a lot of sunlight. But those interventions really, really transformed the way that I was able to perceive the world. And I felt so much better. And, working as a professional in the mental health field, I had never, ever come across something that was that profound before. So as I was starting to learn more about these strategies, I just saw how important it was to start spreading the word about this, and just teaching and educating other people about, metabolic psychiatry, and even getting into like why this is working, at a neurological level for a lot of people. So that's kind of how I came across metabolic therapies.
Yeah, sort of that perfect mix of personal and professional experience really culminating to wanting to make a difference in this way. So yeah, that's really inspiring. And how about you, Eddie?
Yeah, so thanks, Bret. So my background's in finance, but on the personal side, metabolic therapies is a very personal area for me. So my journey with metabolic therapies starts in really 2018. My father had been diagnosed with early onset Alzheimer's at the time, at the age of 53. And he was the primary income provider, primary health insurance provider for my mother and my brother, who was 15 years old at the time. So that posed to be a challenge that we had to rally around him for and figure out. And as you could probably imagine, going through the proper channels, standard of care gave him a pretty poor prognosis, had really termed it as a very fast progression. And it wasn't really the greatest marching orders. It was just getting affairs in order and waiting it out. But of course, we had banded together, rallied around him, and got to searching for anything and everything that could help. We found that metabolic therapies like the ketogenic diet and fasting could help. We thankfully found the Bret Scher protocol as well, which has a variety of metabolic therapies as core modalities as part of its treatment. We didn't just find hope, which that in itself was such a major departure from what standard of care was telling us, but we found evidence-based strategies, research and real-life case studies, and examples of major improvements from people all over the world that they were making with these approaches. So we started applying these metabolic therapies as a family. My father experienced major improvements in the first year and a half, increased his cognitive test scores measurably by almost 40%, something our initial neurologist told us was impossible. The COVID came in 2020, and that hit my dad hard, posed a whole new set of challenges, as it did for many. He went into a dementia psychosis as a result of that, which was kind of out of left field. Again, we were given another really poor prognosis. And we really told that he was at the end of the line with this presentation of symptoms. But again, with making adjustments and persevering with metabolic therapies and addressing root causes with the help of a great care team, he was able to come out of that. And within another year, was able to lose that dementia psychosis, a diagnosis, come off of antipsychotic medications, and hasn't looked back. Something, again, we were told was not possible. And instead of seeing him, get much worse in a short period of time, like we were told, we fast forward to today, and my dad's still going, and he has his challenges, but he's defied so many of the poor prognoses that he's been given over the years We're grateful for the time that we've had. We're grateful that we can continue to press forward every day with these metabolic therapies and learn from it. And as for myself, I've got 3 young children. I've got a 4-year-old, a 2-year-old, a 4-month-old. And it's a little strange being 35 and having learned long-term care insurance set up. But I have faith I won't need it because I want to be there. My determination is to be there for my family and for my kids and be healthy and strong and functional.
Yeah, I mean,
But
this is the perfect example of, medicine declaring something as deterministic, nothing we can do about it. But that really just means they haven't explored all the opportunities. We don't know what we don't know. And that's the prime opportunity to explore something like metabolic therapies where there is so much promise, but really sort of underexplored, no question about it, in terms of research and funding and attention that's been getting. So another very powerful individual story showing us how we really need to broaden our perspective and our treatment options. Well, which leads us then to Metabolic Collective. I mean, look at Metabolic Mind. Obviously, we're very in tune to these stories that you're talking about and this subject and passionate to getting the information out there, but we can't do everything by ourselves. So we are thrilled that Metabolic Collective exists. So Natasha, tell us about Metabolic Collective. What is it? What do we need to know about it?
Yeah. So when I think about Metabolic Collective, I really think about all of the individuals who have come across, all of these. Again, I keep using the word profound, but that's really essentially the word that keeps coming to my mind here is these profound, interventions and how it has helped them reclaim their health and their mental health. So when I think about Metabolic Collective, we are working a lot with individuals who have had their own lived experience. And I feel like more and more of them are coming forward where they come across like great resources like Metabolic Mind, or they're starting to learn about a lot of the emerging research that's happening right now. They're utilizing the metabolic interventions and treatments, and then they're coming, they're kind of coming out of the woodwork and they want to have a sense of community. So I think what Metabolic Collective is really trying to do here is we're trying to harness, the excitement that is coming our way from these individuals who want to connect with like-minded people and who are so excited that they were able to reclaim their health. They want to be able to go out and advocate in the community. So we're really a grassroots movement that is kind of harnessing. When I think of, anything to do with metabolic interventions, it's energy, right? So it's like we're utilizing the energy of all of these individuals who are so excited and so passionate to now go into the community and spread the word about these interventions, right? I think the Bazooki Group is doing an excellent job with helping promote the research. Metabolic Mind is doing an amazing job, educating the general public. And now Metabolic Collective, we're going to be working with, on the ground floor here with the public directly and giving them, the resources and, the coaching and the help that they're going to need to now become great advocates within their own communities. So I think in Metabolic Collective, that's kind of what it is in a nutshell. It's also a not-for-profit organization. I probably should have said that right from the get-go, but I'm so passionate to talk about this and I'm so excited to build this community. I just jump right into like, how are we utilizing, the community and the people within it?
Yeah. Your passion is very palpable, and that's great. And I should mention that, we spent time together at the American Academy of Family Physicians Conference, where we were talking to, hundreds and hundreds of doctors about metabolic therapies and metabolic psychiatry. But that shows how you in particular can really bridge that gap between talking to the clinicians and talking to the individuals and really sparking this ground movement, which is great. So Natasha, with that introduction, what are some of the specific activities that you've done to help sort of mobilize this community?
Mm-hmm. So right now we're kind of looking at 3 key areas. So the first one is, how do we get individuals to start leading their own groups or their own projects or their own movements within the community? So, a lot of this is built off of this rebuild framework, and rebuild comes from Metabolic Mind's Think Smart model. So for those who don't know, the Think Smart model is kind of this general guideline of how you can incorporate metabolic interventions. So it's an acronym. The think component of it talks about the therapeutic use of ketogenic interventions, and the SMART talks about other strategies such as sleep, movement, and the R in SMART is rebuild. And that is such a key component to what we're trying to do here in the community is we are trying to rebuild the community. We know that healing is going to happen better amongst the community and amongst other people. I think a lot of times if you're trying to heal in isolation, it might not be as powerful. So one of the things we're really trying to do here is bring people together so that they can connect with like-minded people to start their own groups or their projects. Another thing that we're looking at doing is it's called the Advocate Resource Hub. And the Advocate Resource Hub is going to be on our website, and it's downloadable tools and resources. So we're going to have a toolkit for individuals who might want to lead a group. So those are going to be different resources on what you might want to consider if you're starting a group, maybe some guideline ideas. It could be, how do I want to develop values and cultures within my group? So there's going to be a lot of just kind of worksheets and exercises that people can go through. We're also going to be adding a downloadable slide deck about metabolic psychiatry, along with a course on how to deliver the slide deck. So the idea here is that anybody can download the slide deck and tweak it, tailor it to their target audience to then deliver a thorough presentation about metabolic psychiatry within their community, or if they're involved with another organization that might want to know a little bit more information, somebody can just, pull the slide deck and deliver their own presentation as a way of advocating.
Wow. I love that. I mean, there's so many patient-focused mental health agencies out there that probably don't know about metabolic psychiatry. So if somebody were involved in that, just to be able to use those talking points to give a presentation, I think would be so powerful.
Yeah.
Yeah, that's great. Now you're a relatively new organization. I mean, you haven't been around that long, but I'm sure you already have sort of plans for how you want to grow and expand and what the future would look like. So Eddie, what are some of the highlights of where you see Metabolic Collective going?
Yeah, look, Metabolic Collective, our mission is to accelerate the real world adoption of metabolic therapies, especially ketogenic protocols for serious mental illness and neurological disorders, by building that global peer-led grassroots movement. And where we're really ultimately going is, our vision is to see these metabolic therapies as first-line treatments alongside what's currently out there, not something that is thought of as an afterthought or an add-on, but really something that's offered alongside, if not in replacement of just the pharmaceutical-only approach for mental illness and for neurological disorders. That's what we really want. I mean, we're rooted in these core beliefs that recovery, often full remission from conditions like bipolar disorder, schizophrenia, major depression, OCD, PTSD, dementia, Parkinson's, and other neurological disorders is possible for many people using metabolic ketogenic interventions, as seen in this growing wave of trials, studies, case reports, and series, as well as the anecdotal N of ones, our own lives. So building off of that lived experience, this concept of experts by experience, which is what the collective is, we believe that's the most powerful accelerant for awareness, adoption, and long-term adherence. We need to connect. We need to come together, like Natasha said, and end isolation, because connection and purpose in themselves are forms of metabolic medicine. So as we do that and we support each other, we really see Metabolic Collective becoming a decentralized, scalable model for advocacy and for closing, hopefully, this 17-year gap that is often seen between groundbreaking research and practice. It's a grassroots infrastructure that we're building so that we can see these as first-line treatments in standard of care closer to within a decade and not two. So that's what we ultimately want.
Well, that's a great point, though, about the delay that we often see between research and implementing clinical care. And that's, I guess, sort of a bit of an uphill battle for any grassroots efforts if the individuals you're trying to reach say, well, my doctor didn't tell me about this. I didn't hear about this from all these physicians I'm seeing. So why should I believe it if my doctor's not telling me about it? So how are you sort of helping address that in individuals to overcome some skepticism that they're hearing it from people who've lived it, but not the treating clinicians?
Yeah, that's a great question. Many of us have confronted the same sort of thing. And we've had to simply continue to find different opinions and continue to search for different care providers or care groups. But not everyone is inclined to go get a second and a third and a fourth opinion, right? But what we believe is collectively working together. If we could do so much individually, when we come together and we can continue to educate each other, there's a synergy that builds where people can become more convinced to just do something as simple as advocate for themselves or their loved one in the doctor's office with simple strategic questions. Sometimes it's hard as a patient or a caregiver to have any question in the doctor's office and to blindly follow whatever is given as a treatment option. So I think it's powerful when you have a growing wave of people who can, at the very minimum, come in and ask, have you heard of metabolic therapies? What is a metabolic therapy? And as clinicians continue to field those questions and are prompted to have to come up with answers, I think we start to see a difference in how standard of care starts to approach what is now, or maybe has been, some sort of outside therapeutic approach. I think it starts to become more integrated and absorbed as more people can come in and ask those questions and prompt their doctors with that.
Yeah, that's good points. And so, Natasha, often, or I shouldn't say often, but sometimes when there is sort of this patient-based, lived experience-based grassroots movement, it can take on sort of an anti-establishment approach in the sense that we don't need the care that they're providing. We can just do this instead. So how do you, with this community, how do you help sort of navigate that, if that even comes up, that sort of perception?
I think more than anything, we just want to empower people to take care of their own health, but in a way that they can also collaborate with their physicians or their clinical care team at the same time. And the two words that are really coming to my mind here are education and curiosity, right? We need to be curious when we're looking at these new emerging therapies and the research that's starting to back them up. Even in terms of being a clinician, like, we need to kind of like pull back and recognize that a lot of the things we have been doing just have not been working for a lot of people. So we need to start, to understand why could that be happening and what are some of these underlying mechanisms and how are we actually treating and addressing root cause here. So, it's interesting because, we don't want to go anti-establishment. We don't want to go anti-medication here, but we also want to educate people that there can be a different way, or there can be a way to complement the current treatments that are happening. Right. So I think the more we can empower the community that we're working with, the people who have lived experience, and teaching them, how do I have those conversations with my healthcare provider, or how do I develop the elevator pitch so that I can start to tell, other people who might be practitioners or clinicians about, the emerging evidence with metabolic psychiatry and neurology. So I think right now what we're finding with the new emerging evidence and the research here is that ketogenic therapies can be really helpful in conjunction with current standard treatments and standard of care.
Yeah. And that makes sense, since the evidence to date has really used ketogenic therapy in addition to standard of care. It's not instead of, it's in addition to, and then, change and adjust as needed, as with any new treatment you would do. So I think that's an important point too, which can sometimes be challenging if the clinician hasn't heard of it, isn't aware of it. So, Eddie, with your personal experience with your family and with your father, can you help patients and individuals learn how to advocate with a clinician who doesn't know what they're talking about? Like, do you have resources or advice for them specifically how to handle that?
Yeah, absolutely. What I'll preface this with is, I will say that every clinician, every doctor I've worked with throughout these years, my personal experience is that everyone was well-intentioned and everyone had their heart in the right place. And sometimes it has felt like maybe you don't know what you're talking about. I think what's going on is there's this gap between what is out there in research and what some doctors are educated on. And that is something that we've had to be empathetic to. As far as advocating for ourselves, asking a lot of questions has been a good way to just suss out whether we can have a productive conversation, a productive back and forth, and if a doctor will be willing to help us get certain labs or entertain certain therapies and approaches and modalities. For me, we've always walked in with the research studies. After a couple of years, I just decided we're going to walk in with a couple of books or a couple of research studies so we could point to them. And if it was something that we could have a productive conversation about, then we'd run that up the ladder. And if we couldn't, at the very minimum, in that office, someone walked away with, maybe I've got to go check that out. And I think if more people did that with their doctors, I think they'd be surprised to find out that more doctors would be open to really looking into this. But the medical system is very busy and doctors are very busy. So sometimes, unless you have the tangible study on your computer, right there in the office, or the book or the study in your hand, it's not super easy to get your doctor to take a look at it if they're not already educated on it. But that's what I would suggest, asking a lot of questions and going directly to the source and bringing that source to the doctor. In fact, I bought several books for my doctors over the years and just sent them to the office so that when we went back, they could see what we were working on and they could be on the same page. And I'm happy to say that the majority of them received it well and were willing to entertain it.
I had a thought that came up when Eddie was talking there, and it was, we don't know how all of the clinicians and physicians are going to respond, but it is worth taking that shot, right? Like you said, Eddie, just providing that research, giving the books, right? Because even though someone might not be receptive to it quite yet, it doesn't hurt to plant that seed, because it doesn't mean that they're not going to be receptive to it down the road. And at the end of the day, I think most clinicians go into, the healthcare field because they genuinely do want to be helping other people. I think that's true for the vast majority, right? And they do get caught up in really busy schedules and maybe not having the time. But that's also part of this movement, is if we can get enough people to start advocating to their physicians and, other healthcare practitioners, that over time it's going to get to the point where, you're just not going to be able to turn away from it anymore. You're going to have to acknowledge that it's coming.
Yeah, look, we see this as an inevitability. The research studies are showing us some pretty impressive things. I'm not a doctor, I'm not a PhD, but from where I've been standing for the last several years and from what I've experienced in my own personal life, the research is demonstrating some very extraordinary things compared to what has been in the past. So there seems to be a superior way, and like any superior way or technology or approach throughout history, there's an inevitability for it to become predominant. In any market, for supply to change measurably, demand has to change first. And what we really believe is, on the collective, we are helping shift the demand side of the equation, where more people, because I can tell you something right now, maybe some people feel comfortable with one approach or another treatment approach, and they don't feel comfortable with this sort of approach, or they might be hesitant with this one, but everyone has the appetite to get better. And when approaches get better, our intention is not to be anti-establishment. Our intention is not to be rogue. We just want better for our family. And if something's going to get them better, then let's explore it. And I'm willing to have that conversation with any doctor, and I think anyone would as well, when we have enough people who start demonstrating that palpable appetite for these approaches because they're helping better than old approaches had, then I think you start really getting some movement on clinicians saying, I'm getting more people asking about this. Maybe I should do a CME course on this. Maybe I should get read up on the research. And I think that supply only changes measurably when enough people start to demand it and demonstrate their appetite for it. So I'll leave that there.
Yeah, I mean, that's a great point. The power individuals have in helping motivate, educate, steer their own clinicians into new opportunities and new ways to learn. I think that is important. People may not realize that. They may feel sort of intimidated, right? There's this classic hierarchy of the physician up here and the patient down here. But no, I mean, you can be equivalent in many ways, especially with new and emerging information that hasn't been taught. So I think that's a great lesson. Well, so say someone is listening to this and it really resonates with them and they say, wow, I want to be part of this community. I want to see how I can help. So what are some ways that people can right now get involved and help out?
Yeah, so currently we have a few different ways that you can get involved. So you can go to our website, which is metabolicccollective.org. And at the bottom, there is a form that you can fill out if you would like to be involved in. There's a form that you can fill out if you'd like to be involved in helping with some advocacy work. In addition, we do have a private Facebook group that we've recently launched. And even when I started, so I've been doing this for just over a month now, that Facebook group has grown by 100 people just in the last few weeks. So there's a beautiful community in there. So if you are interested in wanting to connect with people right away, I would encourage people to to come into the Facebook group. It is Metabolic Collective. We are also on X. So we are talking about different initiatives that we're launching on X, and we have a few different community events. So one of the events that we're starting to launch monthly is called The Watering Hole. And the watering hole usually has a guest speaker who's talking about some kind of a metabolic intervention and then gives a guided exercise. And then the last half of that group, everybody kind of reconvenes. We then have discussions about, just different initiatives that we can do within the community to kind of advocate for this type of work. So those are some of the things that people can do if they want to just get connected right away.
Don't underestimate the power of just speaking about what you're experiencing. If there's anybody out there who's working on a metabolic therapy and is seeing improvement and they're working through it, or it's been several years and they're doing really well, I see it all the time on the socials. We have this amazing electronic decentralized nervous system between us all called the internet and social media. And it's a beautiful thing to see all these people have these great testimonies for different ways of how they've healed or how they've recovered or remissions. I suggest that everyone go to Think Smart and check that out and be inspired and learn from that. If you have a story of your own, participate in that, because every person who can publicly, I know it's a personal thing, but every person who can publicly share their testimony and share what they've been doing, you have no idea how many people you're helping behind you. You're opening the door for so many other people behind you, because as humans, we're meant to model. We model each other. And for us to be able to have role models, I couldn't have helped my dad if there hadn't been already role models in front. So don't be afraid of sharing your story, and don't be afraid about talking about it, because there's a lot of pain and suffering out there. Of course, this is positive. This is encouraging, but we are working to reduce drastically, if not eliminate, a lot of the pain and suffering out there. And it happens through dissemination of information. We want to get this out to as many people as possible so that they can take a look at it for themselves, make a decision for themselves. And if they have someone in their family that they would like to help, that there are resources available. And we want to make that as accessible as possible to them. So I'm done with that.
That's great. That's great. Well, thank you both for joining me. And Eddie, if people wanted to, learn more about you and follow you and your work, where can we direct them to go?
Yeah, I appreciate that, Bret. You can just check out my YouTube channel, Brain Health. You can type in Brain Health there and you can find it. And that's, you can find me on X as well, Brain Health.
Great. And Natasha, you told us about where to find more about Metabolic Collective, but what about you as an individual? Are there ways we can follow you as well?
You can follow me through Instagram. I'll often have people reach out to me when they have questions just about, metabolic psychiatry in general. In addition, if you join the Facebook group, I am an active administrator in there as well. So I do participate in a lot of the group and community discussions.
Well, thank you both for all the work you're doing with Metabolic Collective. I'm really excited to see how this grassroots community grows and the involvement it has and the impact it has on so many people's lives. So it's really special to watch. So thank you both very much. I appreciate you taking the time today.
Thank you.
Thank you, Bret. Really appreciate the time.
Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.